Hello to all my Medicare recipients. My name is Heidi Broberg. This is probably the first time you're meeting or seeing me. As I have hundreds of clients, I thought it would be beneficial to have my first meeting or my basics of going through Medicare on a file that you can watch ahead of time. And that way, when we spend our time together, we can look at your personal information and plans. So I want to keep it quick today. So I'll try to go through this fairly quickly. It might be review for some of you. You might have many more questions after listening to this. So my job is to hopefully clarify some questions you may have regarding Medicare. So I'm going to start off by sharing my screen here. You can probably still see me in the corner. Let's see if I hit present. But I'm going to be going through Medicare Made Easy, or breaking down how Medicare is. So this is your Medicare card, and we're going to look at it in a little more depth with your Medicare number, your claim number, which used to be your Social Security number, but now is a random number, your hospital Part A effective date, and medical Part B effective date. So when you hear me ask for that information, that is what I'm talking about. So just real quick, again, you get to meet me in person here, not in person, but on talking to you. My name's Heidi Broberg. I have been doing this since I graduated from college, so well over 20 years now. I've been in the health insurance industry and almost 20 years alone in the Medicare world. So when I say I offer Medicare solutions, I do all the various types of Medicare plans. That's Medicare Advantage or MAPD plans, Medigap or supplemental plans, Part D prescription drug plans, you name it. I do all of the different types of plans. I also contract with most all of the major carriers that are around. So you'll see those names there: AARP, Aetna, Alignment, Anthem, Blue Shield, Health Net, Humana, Intervalley Scan, United Healthcare, and there's also a lot more I contract with. Those are just the main ones. I'm licensed in various states. I've added many more since then. So California is my resident state, but I'm in Arizona, Nevada, Idaho, Oregon, Utah, Florida, New York, Virginia, list goes on. And that's because clients have moved out of the area and asked me to stay their agent. So no, you do not need to pay me. I am reimbursed or paid by the insurance company. So that's one of the first questions I get is, how much do you pay me? My job is to educate you, hopefully get the right plan for you. Of course, we may have to adjust that over the years, keep you happy, and then you stay my client. And so many people just enroll their clients and forget about them. I try to keep in touch and make sure I'm helping. And when we run into issues, which we almost always will with health insurance, right? Try to the best of my ability to help you out. So again, talking about Medicare, the first step, so these are kind of, I like to tease, it's kind of choose your own adventure. This is the hardest part for most people. After you're able to work with me, I really can simplify it. But the first part is enrolling in Medicare. Now, if you're retiring, you're turning 65, you're claiming Social Security, that's the easy step. You're going to be automatically enrolled in your Part A and Part B of Medicare. So the Part A is what you have paid for as you were working. So as long as you or a spouse has those 40 credits, you should automatically have Part A when you turn 65. And again, if you're no longer working, you're turning 65, you're claiming Social Security or railroad benefits, you should be getting Part B. Now, this varies for a lot of people because maybe you're still working and you have benefits. Maybe you need to keep a spouse covered, so you're still going to keep that. You're not claiming Social Security. Those change that. You can actually delay your Part B if you have credible coverage. So that's very common. A lot of people are still working, have credible coverage. You need to check with Medicare to make sure you have credible coverage, because you can be penalized if you do not have credible coverage. That goes for medical coverage and for a Part D prescription drug plan. So I have some clients who even have a health savings account through their employer group. So they don't need to get the Part B delayed, but they do not have credible prescription drug coverage. So we do need to add a Part D prescription drug plan. I probably confused a lot of you, but again, you're getting Social Security, get A and B. If you're retiring, and even if you're not going to claim Social Security, that's fine, but you will need to apply for your Part B, okay? And the Part B does have a premium, and I'm going to go through that in a minute because it varies now. There was a law passed. So the Part A was paid for as you or a spouse was working. Very rare that it's not. I can answer questions if not. Part B, you pay a premium for that. The average is about $150 a month. And again, this is just for Medicare. So that's saying, I'm just going to cover my screen. That's saying you did not do anything additional. You just had your Medicare. Okay. So again, if you have questions on delaying Part B, let me know. Then where I come in is once you have that Medicare A and B, the step 2 in choose your own adventure is deciding which options will be the best for you. And this is what I really need to break down and help people understand. My job is to educate you. Your job is to figure out what's going to be the best fit for you of these 2 options. And then I will help you with which companies, with which benefits, with which prescriptions, okay? So option 1 is your Medicare Supplement insurance or Medigap. These are all offered through private insurance companies like the ones I mentioned before. So what happens when you do a Medigap is you have your original Medicare, which I'm going to talk about those benefits as primary, and then your supplemental is going to step in after that. And actually, I think I go in a little more detail, and I will do that in just a moment. But it does not include prescription drug plan. Okay, so you would need to add that. This allows you to go to any doctor without a network. You can go to any doctor, anywhere, anytime. But on top of the Part B premium, you're already paying for Medicare, you will have another additional premium. Anywhere starting, the lowest I've seen is about $140-ish a month. And this is quoted underwritten, so we would look at that. And then the lowest plan I have is a $7. So let's say you're not taking any prescriptions, we would just put you on the lowest cost plan. But if you're on a lot of high cost medications, that can go anywhere up to $180 for a plan. Okay, very uncommon. We can usually keep it within the $30 range. Okay, so that's option 1. Option 2, which has become much more commonplace now, is your Medicare Advantage plans or MAPD plans. These are your various HMOs, PPOs, POS. All of those fall under this Medicare Advantage, where they have a network. Whether you can HMO, you have a network, you get your referrals outside of the network. A PPO, you still have in-network and you can go out of network. Some counties do not offer anything other than an HMO. That's what I break down for you. But it combines your Part A and Part B, hospital and medical, into one plan, the Part C. It includes prescription drug coverage and also has a lot of additional benefits. The Medicare Advantage companies are now offering a lot of included vision, dental, sometimes transportation, over-the-counter credits. So they've really come a long way. But again, most counties, you're going to need to do the HMO, where you have a primary doctor who contracts with the medical group, and that medical group is going to oversee your referrals to your specialist. So more than likely, you'll stay within that network. These are very low premium in comparison to the Medigap or supplemental plans. Most of the counties where I work within the various states are 0 premium, no additional cost, to a low premium, maybe $40 a month is probably one of my higher ones. So again, that option 1 is Medicare Supplement or Medigap plans, where they're going to cover most, depending on the plan. So if you've heard of Plan F, Plan G, Plan A, those are all, and I know all these letters and numbers are so confusing. And I will help you with that. Plan G is the most common Medicare supplement plan that I do for my clients right now. And what that does is it's a little higher premium, around that 140 if you're new to Medicare, like I said, but it's going to pay for almost all your out-of-pocket expenses that Medicare does not cover. Okay. Here is, again, can I move my face here? Your Medicare supplement plans. These are those various plans I just mentioned. Okay. So the plans available to all applicants only. There was a law passed. So, you know, back when I was doing this 5-10 years ago, F was the main plan because it had the most coverage. You are no longer able to do that unless you had Medicare before 2020. So the next most comprehensive plan, like I mentioned, is G, around that premium. And you can see it has coverage down the line. You do each year pay the Medicare Part B deductible. So going back to what Medicare alone would charge, that deductible is about $200. Let's just round up, and don't quote me on this. You can always check your Medicare and You booklet for the exact amount. But typically that would be about $200 a year, meaning you would go in for a surgery, you would pay your $200 deductible, and then the rest of that hospital or the doctor visits, blood, hospice care, skilled nursing, all of that would be covered after that $200 deductible, okay, including excess charges and foreign travel emergency. And again, if you elected this option, I would go into more detail with you. I just want to go over the basics. Here is, say, a plan G, like I said. So here's what Medicare would pay. So you can see some of your, let's see, kind of smaller, I'm sorry, if you just had straight Medicare, what that would cost you. If you have the plan, this is what they would pay. And then you can see here with like a G, what you would pay. So see all those zeros, and here's that 198 or that 200 I had mentioned for that Part B deductible for Medicare. So it's not saying you pay this every time if you give blood or have home health. It's saying that would be the amount, whichever came first to meet before those kicked in. And then the foreign travel emergency. And I will go into this in more detail. So again, most people get their Medicare in a few ways, like I'm chatting to you about. Original Medicare. So again, that's just straight Medicare, someone that just only had Medicare, which would put you at a very high risk if you had out-of-pocket expenses. You also would have to add a Part B prescription drug plan, or you could be penalized. Okay, option 2 is having original Medicare plus the Medicare Supplement plus the prescription drug coverage. So that was that first option I talked to you about. And the Medicare prescription plans are that Part D. And I'll go through this in a little more detail later, but a standalone would go with your Medicare Supplement, or it's included if you do Medicare Advantage. Okay. Here is the prescription drug plan. So you've probably heard how a lot of these prescription drug plans work. It is very confusing, and this is going to be a very, very broad overview. So we'll need to go into this in detail at your medications, but each plan is set up differently, but it has this Medicare basic understanding where you have a deductible. So if you had a deductible, that would be, you know, let's say a $300 deductible for your prescriptions, meaning you would pay your copay, but that would go to that deductible. You pay for your drugs reaching that deductible plan. And I'll be able to give you an individual layout of your prescriptions. The initial coverage periods, you just pay your copay. You're staying in this stage. Most people are able to stay in this stage if you have mostly generic medications, meaning you're just paying your copays throughout the year, probably what you're similar to what you're doing now. And you would stay in this stage until your total drug costs were to reach $4,020, not your copay amount, but the actual cost of the medication. So what you pay and the insurance, the cost of the medication is adding up. If you hit that amount, you then reach what's called the coverage gap or donut hole. We have this coverage gap or donut hole again after that 4,020. In 2020, this updates each year. So I can give you, you'll always have that updated. You'll get a statement actually every month in the mail that says you paid this much, your company's paid this much, you have this much till you hit the coverage gap. So then you would pay 25% for brand name or generic until you're out of pocket cost. So again, how much you paid here. And then again, of that 20% reaches 6,350, at which time then it goes much lower. So this is what it was created for, is those who are reaching this catastrophic coverage very quickly. So let's say they had one medication that was $6,500. They're going to reach this in January, and then it's going to help them for the rest of the year. Again, most people can try to get on generics. I have a whole email on how to save and try to do that. You want to stay in this initial coverage period. What I have found is towards the end of the year, some of my clients who have maybe some higher cost medications might hit that coverage gap or donut hole. So I just want to make you aware of that. Okay, option 2, and sorry, I keep hitting my little thing here.
Sure I understand.
Siri's not understanding me. Your Medicare Advantage plans, these are offered again through private insurance companies, combining your A and B. These are those MAPD. You see all those commercials online. Typically, they're for these Medicare Advantage plans. So again, I talked about these are your HMOs, PPOs, PFFS, special needs plans. So there is special needs plans. Say you have diabetes and you have high cost insulin. Many of those insurance companies offer special plans that are tailored to those folks who have that chronic condition to help with those out-of-pocket costs. So especially when we're talking about the prescription drugs, that can help with those out-of-pocket costs. Again, I said they have lots of additional benefits that they add: fitness and rewards programs. Some of them offer Fitbits or the free silver sneakers or gym renew active gym memberships, vision coverage, very basic dental coverage. When I say dental, that's a rough one. I'm just being honest, but it's changing. Hopefully it will get better. Access to mail order, of course, and many have over-the-counter allowances, meaning they give you $75 to CVS or whoever they contract with, and you can get your Epsom salt, Band-Aids, things of that nature. Okay, and so this is just one company, and actually I'm going to skip this because that is so many. So I will break down for you which companies and compare those benefits to you. Many times they're very similar with the various companies. So it's going to be looking at the extra benefits and the prescriptions. But that first choice you need to make is whether you want to go with the Medicare Supplement or Medigap plan or Medicare Advantage. So again, just a real quick, I'm trying to keep it quick. The Medicare Supplement plans, you can go to any doctor anytime. That is the major pro to that, is you have a doctor, and actually I use my parents as an example. My dad chose the Medicare Supplement plan. He's had major vision issues. He has had heart attacks. So he has doctors in Loma Linda, in Orange County, in LA, all over. He could have chosen a Medicare Advantage plan and chose new doctors, and they would have given him the referrals he needed. But for him, for right now, he decided to go with a Medicare Supplement so he could go where he wanted to go till he found new doctors to be comfortable. That's the pro to that. The major con is you're paying out of pocket a lot more for that. So again, you're going to hit another 150, and if you're older, even higher. And I can give you the quote and rate on that. And then you have to add your prescription drug plan. But that network, being able to go anywhere, basically a prepaid plan. You're paying up front monthly, whether you use it or not. But then when you go in, just reaching that deductible with, say, a G plan, most of it will be covered. Medicare Advantage plans, MAPD, Part C plans, whatever you've heard, those are all the same thing with a different name. These are your network plans. So most of you probably have a doctor who's contracted with a network medical group, and they refer within that group, unless I've had many, many clients who say have been diagnosed with cancer. And I'm just going to give an example. We're here close to Upland. A lot of people have Prime Care or Regal Medical Group, and their doctor refers within, San Antonio is their hospital or whatever that might be. But when they've been diagnosed with cancer, we're able to get that referral to City of Hope or outside of that network. But again, that's going to be up to the doctor and medical groups. So a lot of people call me and say, hey, Heidi, get me here and there, where I have no say whatsoever in doing that. So it's knowing how to work with that. So my mom, fairly healthy, sees an allergist, sees her various doctors, but said, I absolutely want to save money. I'm fine getting my referrals. I get all those extra benefits, and, I don't have to pay that much out of pocket. So I'm going to go with a Medicare Advantage HMO. So that's probably the biggest question I ask, is people say, well, what would you put your parents on? And that's why I say this is such a personal question for you to know what's best for you. So some people coming off an employer group plan say, oh, that's no big deal at all. Put me on a Medigap supplemental plan. I'm paying $500 right now a month for my insurance. This is nothing, no problem, easy. That moves us to option one. Some people say there's no way I could afford, that much out of pocket. Even, of course, I'd want to have that, but there's no way I could. Easy, option two. Most of the time people are, down the middle. Of course, we want to pay nothing and have all the access, but unfortunately, that's not how it works. But once you have your Medicare, just deciding what do you think would work best for you? If you're willing to go to the doctors and want to save, we would go Medicare Advantage route. The hard part is just to make sure you understand this. Once you're Medicare Advantage and wanted to switch back, it's much harder to get on a Medigap plan down the road because they underwrite you. So they could decline you if within 2 years you've had a heart attack, and that rate's going to go higher. If you're 85 years old now and wanting that plan, they're going to say, oh no, you're a higher risk. So now it's going to be $350 a month. And I could pull that for you, but just so you know, where, like my dad's situation, he eventually does want to do a Medicare Advantage HMO plan, but he said, I'm going to start here and just see how it goes the next few years, which is totally fine. And then switching over to an HMO or a Medicare Advantage plan is easy. During open enrollment, we have those open enrollment periods, and he can switch on over during that time frame when needed, and no questions asked. Those are the same plans for every person in that zip code, based on zip code with the various plans. So the next steps here, we're done. But one, if you haven't applied for Medicare A and B and you need Medicare, that's your first step. You can go online, you can call them, or go to the office to make sure you have Medicare A and B. If you're delaying it, go ahead and contact Medicare, delay it, and then a few months, maybe 4 months before you're retiring, give me a call and I'll walk you through how to do that. So step one, get your Medicare A and B. Once you have that approved, step two, decide which option you're going with, a Medicare Supplement, Medicare Advantage. Step three, schedule an appointment with me. Make sure I have your name of your doctors, your medications, and which option you're going through. And then we can really start breaking it down. I can give you different rates and show you your medications and explain the details on how that works. So that's the next step. So I do have a Calendly app, so you can schedule an appointment with me right online. You can give me a call, you can text me or email me, and I will be happy to follow up. So I hope this was helpful. Sorry if I went so fast, but trying to just share some information with you real quick. Hope to talk to you soon. Thanks.